everyone. Welcome back to Handy and Capable. Or if you're new here, welcome. I'm so glad you're here because today's episode is an important one. We'll be talking about Medicaid, Medicaid waivers, and Medicare, and what's happening right now that could seriously impact people with disabilities, including me, and maybe even someone you know or love. If someone in your life relies on Medicaid, Medicare for health care, personal care, assistance, home support, or therapy, then trust me, you're going to want to hear this one. Let's get into it. So, what's happening with Medicaid and Medicare? Let me start with the basics. Medicaid and Medicare are two essential government programs that help millions of disabled individuals get the health care that they need. Medicaid covers everything from doctor visits and hospital stays to essential support like personal care attendants and home modifications. Medicare, on the other hand, primarily serves people over 65, but also covers many disabled individuals under 65, including disabled adult children or DACs, who qualify through their parents' benefit. Let's talk about Medicaid cuts and block grants. But here's the problem. Medicaid is on the chopping block. DT is looking at major funding cuts to Medicaid. And if these go through, the impact on disabled individuals could be devastating. One of the biggest changes being discussed, capping Medicaid spending to a fixed amount, which would mean less money for states to fund healthcare services. Another proposed policy? This could put thousands of disabled people at risk of losing coverage if they don't meet those requirements. And let's be real, not all disabilities are visible. A lot of people who rely on Medicaid for support can't work traditional jobs, forcing them to prove their disability again and again. It's exhausting, unfair, and completely unnecessary. Let's talk about the hidden threat: Medicare cuts and disabled dependents. Now, Medicare is also at risk. While the conversation has been mainly focused on Medicaid, cuts to Medicare funding could also leave disabled individuals without primary insurance. Here's why that's especially dangerous. Many disabled adult children receive Medicare through their parents' Social Security benefits. If Medicare is cut or privatized, these individuals, including myself, could lose our main source of health care. Medicare is often a lifeline for people with lifelong disabilities, those with cerebral palsy like myself, muscular dystrophy, or other conditions that require ongoing care. Cuts to Medicare Advantage plans or home health services could mean fewer therapy visits, higher copays for necessary treatments, or even a loss of coverage for things like wheelchairs and adaptive equipment. So let's be clear. If these cuts go through, we're talking about disabled individuals losing their health care, not just small budget adjustments. Medicaid waivers and why they matter. Now let's talk about Medicaid waivers, which is one of the bigger concerns for many of us. If you don't know, Medicaid waivers, especially home and community-based services, or HCBS waivers, are what allow people with disabilities to live independently instead of being forced into nursing homes. I am a person that receives this service. The waivers cover things like personal care attendants, home health services, therapies that help people to communicate and function independently, and DME, which is durable medical equipment. It also provides adaptive equipment like wheelchairs and communication devices. Without these waivers, people will lose their independence. I couldn't imagine living my life in an institution or in a group home type setting. I've had an apartment by myself for the last 6 years, and before that, I always had roommates. I couldn't imagine my life completely changing if these benefits were cut. If these funding cuts continue, it could mean fewer hours of care for people who rely on personal care assistance, longer wait lists for Medicaid waiver services, which are already years long in some states, including mine. People that have to wait 22 years or more people being forced into institutions because they lose access to home based care. And let me be clear again, institutionalization should never be the default option for disabled people. We deserve the right to live in our own homes and be part of our communities, just like everyone else. How Medicare cuts will affect me personally. I've talked about how Medicaid cuts will impact me, but Medicare cuts are just as serious because I'm one of the people that depends on it. Many disabled adult children, including myself, receive Medicare through our parents' Social Security benefits. That's how I get my health care. Medicare is my primary insurance, and without it, I wouldn't have access to the doctors, treatments, and medical services that I rely on daily. If Medicare is privatized or cut, here's what it could mean for me. Losing my primary healthcare insurance. Since I qualified through Medicare through my parents' Social Security, any changes to these benefits could leave me uninsured. Higher out of pocket costs for medical care. If funding is reduced, I could be forced to pay for doctor's visits, hospital stays, and therapies that are already expensive. This could also give me less access to specialists. I see doctors who understand my specific medical needs. If if Medicare and Medicare Advantage plans start restricting networks or cutting reimbursements, I might lose access to those specialists. Fewer therapy and home health services. Medicare helps cover certain medical therapies and durable medical equipment, like wheelchairs and shower chairs. Cuts could make it harder for me to get the services and devices that I need to maintain my independence. This isn't just about convenience, this is about survival. If I lose access to the healthcare I rely on, I don't know what I would do. And I'm not alone in this. Thousands of disabled adult children are in the same position. We didn't choose to be disabled. We didn't choose to need Medicare. But if these cuts happen, we could lose everything. I know this is overwhelming. I rely on Medicaid waivers and Medicare too, so I understand how scary these changes are. But I also know that disabled people are resilient, strong, and not afraid to speak up when something isn't right. We deserve the right to live independently. We deserve access to health care, and we're not going to sit back and let it just be taken away. So if you've taken anything from this episode, let it be this. Stay informed, speak up, and never stop advocating for your rights to live the way you deserve. Thank you for listening to this episode. If you think this episode could help someone else, please share it. The more people who understand what's at stake, the stronger the voices become. And don't forget to like, comment, share, and subscribe. I'd love to hear your thoughts on this topic in the comments section. Let's start a conversation. Have you or a loved one been affected by Medicaid and Medicare changes? What do you think we should do next? Let's talk about it. As my friend Jamie used to say, dreams and dedication are a powerful combination. Until next time, stay informed, stay strong, and keep fighting for what's right. Bye, everyone.